collaborative webinar using a mindfulness-based social-emotional learning program with K-2 students, teachers, and parents in Chicago Public Schools, led by Dr. Amanda Moreno from Erikson Institute and by Kandace Thomas of Erikson Institute and the Irving Harris Foundation. Just so you know, we'll be live tweeting at HMPRG with the hashtag ILACES228. So feel free to live tweet throughout the program. While adverse childhood experiences research emphasizes how deeply trauma impacts health outcomes, it also offers a powerful lens to examine public health problems and develop solutions. The Illinois ACEs Response Collaborative illustrates the power of systems-level cooperation to intervene in the transmission of ACEs from one generation to the next. Our many successes have been grounded in a commitment to a collective impact framework, recognizing that no single organization or sector can build community resilience alone. The collaborative fills a critical role by drawing together leaders from different groups to think more broadly about ACEs and by coordinating our varied efforts to effectively move the dial. By expanding ACEs research in Illinois, learning from effective interventions in other states and communities, and strengthening the relationships among the groups in our state working to address ACEs, we can develop the policies and interventions we need to reduce ACEs and combat their harmful impact on our health. You can visit Health and Medicine Policy Research Group's website for more information, including policy briefs and an environmental scan of trauma-informed programs. The collaborative would like to thank United Way of Metropolitan Chicago for its partnership in this collaborative and the following funders who support our critical work: the Health Federation of Philadelphia, Illinois Children's Healthcare Foundation, Crown Family Philanthropies, Polk Brothers Foundation, and the Otho S.A. Sprague Memorial Institute. Throughout the presentation, you'll be able to ask questions and provide comments. Every person on the webinar will be muted due to our high volume of people on this webinar, but we will be collecting your questions throughout the webinar, and we'll be saving those for a 15-minute question and answers moderated session at the end of the presentation. The presentation will be 45 minutes and the Q&A will be 15 minutes afterwards. So please do feel free to type in your questions and answers throughout the presentation. And if you do experience any technical difficulties, please call the number on the screen. After the webinar, tomorrow you'll be receiving an email with the following: a link to Erikson Institute's video about this project, which is about a 5-minute video and very useful. A link to the Atlantic article about this project that gives another context for the presentation you'll be seeing. A short evaluation survey, ways to participate with the collaborative, links to the collaborative's website, policy briefs, and other materials, as well as a recording of the webinar and the slides will be made available. We are very honored and excited to have these two presenters with us launching off our webinar series for the ACEs Collaborative. Professor Moreno joined the faculty of Erikson in 2013 with more than 20 years of work experience in the field of early childhood development, including direct service with children and families, curriculum and assessment development, social policy, community partnerships, program evaluations, and original research. Dr. Moreno studies adult-child interactions and how these can serve as a buffering influence for children who have experienced adversity. In particular, she is interested in how invested adults can adjust their behavior with the children in their care to minimize the negative effects these early stressful experiences tend to have on the transition from automatic to effortful learning. Thus, Dr. Moreno is studying and developing interventions that train adults to support children's self-regulation and executive function, which in turn promote children's ability to successfully engage with increasingly dynamic and cognitively demanding contexts. We're also very excited to welcome Kandace Thomas, who has a public policy degree from the University of Chicago and is currently pursuing her doctoral studies at Erikson Institute and Loyola University of Chicago. Her areas of interest are mindfulness as an intervention strategy, intergenerational trauma, trauma-informed services and systems, diversity-informed practice, infant mental health, program evaluation, social policy, and systems impact on family. Kandace is also a senior program officer at the Irving Harris Foundation, where she works to build developmentally appropriately, trauma-informed, equitable systems of care for young children and their families. In this capacity, Kandace manages a grant portfolio of organizations working in infant mental health, professional development, policy advocacy, training, leadership development, reproductive health, justice, and domestic violence. Kandace was central to the creation of the diversity-informed tenets of infant mental health, 10 guiding principles outlining equity standards in the infant mental health field. She also conducts local and national trainings on these tenets. Kandace is co-founder of Camps for Junior Girls Leadership Camp, and her other experience include policy and program development work on behalf of under-resourced families and communities. As you can see, we are very lucky to have both of these presenters. And without further ado, I will pass on the presentation to our presenters.
Okay, I think my screen is transitioning. Hi everyone, this is Amanda.
Hi, and this is Kandace.
Thank you so much to Maggie and to the Illinois ACEs Collaborative for having us. We're excited to have this, this opportunity and looking forward to some good discussion at the end. So I figured I would start out with the study background so people could kind of get some context for why it is that the two of us can be talking about this, this information regarding mindfulness programming in the schools, and in particular with young children. So this was an Investing in Innovation grant, or an I3 grant. Those grants still exist under a slightly different name. They were started with the ARA funds when Obama first got in office. And there's 3 levels of grant. There's development, validation, and scale up. We're at a development level, which means that the program has not previously been subjected to a randomized controlled trial. So our study is the first study to do that. So you might have heard of the Calm Classroom program if you're familiar with the ACEs Collaborative's briefs that spoke about Calm Classroom as one of the potential education-related responses to trauma in the community. So the program has existed since about 2008. And when I came along as kind of an early childhood person, I was interested in starting out doing a more rigorous evaluation of it at the K2 level. So in addition to the fact that we're now studying it, we've also enhanced the program for just those grades. So if you can kind of picture the way it works is that we do bring the Calm Classroom program to the whole school. And in Chicago Public Schools, typically that means either K through 8th grade or pre-K through 8th grade. So we do bring the program to the entire school, but it's the enhanced program and the randomized controlled trial is occurring only in K2. And to kind of keep that straight, we call that project part of it CCK2. So for the CCK2 project, we're working with 30 Chicago public schools. So we're done enrolling schools. We're now in working with our second cohort of schools. So we're not going to be enrolling any new schools at this point. All of the schools, in order to be eligible for the study, had to have at least 70% free and reduced lunch at their school. And that's for both the treatment and the control group. And I'll talk a little bit more about poverty and toxic stress on the next slide, so you kind of know how that fits into the theory of what we're doing. But as it says, there are 16 CCK2 schools, or mindfulness-based schools, and there are 14 control schools. And in our case, the control group is not a vanilla situation. They are also doing a social emotional learning program called Second Step. That's kind of the default program, if you will, that CPS uses. So we're testing program against program, possibly seeing if the different programs maybe have different strengths in terms of the kind of outcomes that you might expect from each one. And so speaking of outcomes, we are measuring in the controlled trial things like academic achievement, which is a requirement of any I3 grant. You have to measure academic achievement. We're also measuring social emotional learning skills, executive function, classroom climate, student disruption and engagement, teacher self-efficacy, and attitudes towards SEL. Whether using this program sort of helps them feel better at their jobs and feel like they want to continue in their jobs more. Unfortunately, the trial results won't be available till 2019. Believe me, if there's anybody who's impatient about that, it's me. So there isn't a lot to say about outcomes yet. If you have already seen, or if you take a look at when you're sent the Atlantic article, it does talk about some kind of anecdotal initial results. Again, we can't speak to how those compare to the Second Step schools, but we certainly have plenty of stories and anecdotes at this point that we're amassing in terms of what schools and parents and children have to say about what they think the program is doing for them. So right now that includes things like increasing instructional minutes, because, for example, the time after lunch and recess can tend to be a hot spot in the early grades, so it's been helping with that. It's been helping to reduce tantrums. We have specific mechanisms of the program that we use, and I'll tell you a little bit about that, to try and reduce the usage of timeout and to increase more humane discipline practices that go along with this program. So those are the kinds of stories that we are hearing so far. So if you're signing on to this call, I assume that means you have some interest in toxic stress or trauma and know something about it. You may have seen this green, yellow, red graphic. And so for me, I just wanted to say a little bit about how I see toxic stress and how I see the most recent research impacting what we think about it and how we think about interventions. So as you can see, for the tolerable and toxic levels, it talks about buffering by caregivers and supportive relationships. And the difference between tolerable and toxic, according to this graphic, is that with toxic there is an absence of protective relationships. And I don't know about you, but for me, the word absence sticks in my craw a little bit. This is a difference that I have with some of my colleagues in the toxic stress field who really believe that you shouldn't be talking about everything as toxic stress. And I do understand that. But at the same time, more research is coming out showing that stress actually doesn't have to be all that toxic to create toxic stress effects. And furthermore, that we're really not talking about extremes of abuse and neglect. So in the absence of protective relationships, to me, doesn't really fit. So I changed this to toxic stress is prolonged activation of the stress response system when stressful forces in caregiving adults' own lives diminish their buffering capacity. So that the toxic stress is affecting both parent and child and family system at the same time. So I just wanted to point out that, when we have our population where the schools are 70%, free and reduced lunch, there are some complexities to our reasoning for that. But it seems as though it's the case that children are coming to the school door with enormous personal burdens that are far, far short of abuse and neglect, but burdens that affect them nonetheless. If you want to know more about some of this recent research that talks about poverty and how it affects people, and it's a view that I definitely endorse, I recommend, and we can add this to the resources at the end, a book called Scarcity, Why Having Too Little Means So Much by Eldar Shafir. I highly recommend that resource. And so to talk a little bit further about how this affects children, basically, this is a model of sort of how toxic stress becomes biologically embedded. So it starts out with a caregiving relationship, and it can lead to either an over or under reactive stress system, which we are more familiar with as fight or flight. And so basically, the part of the brain that works on a slow basis, which is more of our thinking brain, that gets underused, and the part of our brain that works on sort of a knee-jerk response, that gets over-engaged. And of course, this last part is when kids come to the school door. So, so that's where my interest in the education system comes in. But as I was saying before, unfortunately, these events do not have to be too terribly toxic to create a toxic effect. So as one example of some recent research that I think supports this slightly altered view on how we think about toxic stress, an example is this Mitchell et al. Study that came out in 2014, and it compared two groups of African American boys. They were 9 years old. One group came from a more disadvantaged background, and that was measured by things like income and parental education, and also what they called harsh parenting. And the group that was considered not disadvantaged was higher on these variables. But just to illustrate, for their harsh parenting variable, what distinguished these two groups of boys was that the disadvantaged group had an average of 7 harsh parenting events in the past year. So things like yelling or threatening, whereas the advantaged boys had experienced 3 such events. So my point here is just to say that the advantaged and the disadvantaged group were really not all that different. And what, in terms of this harsh parenting variable, and what the more disadvantaged group experienced doesn't necessarily reach the level of toxic stress in and of itself. But nevertheless, it was found that these that what they're calling the disadvantaged group still experienced toxic stress effects at a very deep biological level, which in this study was measured by what they call telomeres, which is a part of your gene. But the point is that telomeres get shorter as you get older. And those boys had shorter telomeres than the other boys did, meaning that it was basically causing some type of premature aging effect. And again, I just point you to this difference between the two groups. The difference between the two groups was not all that dramatic, at least as I see it, between 7 events versus 3. But yet the other things that were playing a role, such as poverty, such as parental education, all of that in the mix was enough to show this incredibly deep effect of toxic stress. So the question is, what are we doing about it? So why mindfulness? Why did we think about using an intervention that has to do with mindfulness, given the kinds of circumstances that I've just described? So first, I just want to show you our cute little graphic that we use with both teachers and parents and others that we're talking to describe kind of what we think mindfulness is about. So as you can see, it says mindful or mindful. Usually we'll ask an audience to raise their hand if they feel like they're more on the left side or if they feel like they're more on the right side. And for the most part, 99% of the audience raises their hand on the left side. We all know what this feels like, to be stressed, to be having a million different thoughts going around your mind, and to be missing what's right in front of you. As opposed to, and I like this graphic, there's a bunch of versions of it, but I like the version with the dog because it shows how simple, in one way, it can be to just be in the present moment. If you've spent time around toddlers, you know that toddlers are quite good at this. They can play in the mud for hours and enjoy it and not be thinking about anything else other than the way it feels, the way it smells, how much fun they're having. And so I believe that there's something powerful about this ability to kind of regain that ability to stay in the present moment. And I'll talk a little bit more about, okay, but fine, that sounds pretty good, pretty neat perhaps, but again, what does it have to do with toxic stress? What does it have to do with kids in school? So I say, yes, it is a buzzword. We know that there's a lot of talk about mindfulness. There's a lot of press about it, a lot of buzz about it. But I still think that it's a very powerful thing worth this continued investigation. One thing that's powerful, I think, about staying in the present moment is that it teaches without instructing. And what I mean by that is it uses a less sort of intellectualized approach to helping children to think about and experience how they're feeling. And that's illustrated a little bit better in the video that you can possibly see later if you haven't already. It provides what I call bite-sized pieces of these more metacognitive, these more intellectualized processes, making it an easier way in. Okay, so for example, instead of being overwhelmed by all of your emotions and all the different things that we're feeling, it helps you think about just one at a time, just one thing at a time. So even that control that you can think about bringing your mind back to just that one thing, that is really exercising control over your own mind without somebody telling you, please control yourself. This has worked. So there's not a lot of high quality research, but there is some in recent years. And mindfulness has shown to be powerful for groups including children, dementia patients, and those with severe psychological disturbances. And what I think these groups have in common is that they don't have easy access to the highest levels of their cognition. So mindfulness seems to be a more powerful, a more visceral way to help them feel a different way without simply being told to feel differently. So one thing I like to say about this is that, for some things in life, a little bit of knowledge is a dangerous thing. Perhaps something like surgery. You don't want to have a little bit of knowledge about surgery. But mindfulness is not one of those things. So children and dementia patients and severely psychologically disturbed individuals are not having a mindfulness practice that looks anything like a Zen master, right? It's really, really far from being that advanced. But nevertheless, they're still able to derive some benefit because of this simplicity of being able to just focus on one thing and reduce your overwhelm by doing that. You might be familiar with this graphic. This comes from an organization called CASTLE, Collaborative for Academic and Social Emotional Learning, that's based here in Illinois. These are the constructs of SEL that they talk about. This isn't necessarily the only way to talk about SEL, but it's one of the common ways. And so I thought I would use this to illustrate this idea between the different types of ways we could use to help children reduce this overwhelm. So in my view, when you talk about traditional SEL programs, so not using mindfulness, things like second step, things like, you know, you'll talk about different scenarios. You'll say, well, if a friend, you know, runs into you on the playground, how would you feel? How would they feel? So it's kind of an intellectual venture into these emotional issues. I call this approach an outside-in approach. So it starts from these sort of relational skills, and it starts from this metacognitive level. It's asking kids to think about stuff, and then with practice, internalize that, bring that to more of the inner level. Mindfulness, on the other hand, I feel is an inside-out approach. It starts with that inner level, so sort of like getting right with yourself before you can get right with others kind of idea. And I think this, like I said, is not only appropriate for children, but especially powerful for them because it enables them to start small, to start with just themselves. Start with just focusing on the breath, and then with practice that can begin to generalize out. So what it does is it creates this visceral experience, and it allows us to get rid of these metacognitive sorts of phrases, such as calm down and pay attention. We know that these phrases don't work. Teachers know that these phrases don't work. Parents know that these phrases don't work. But we as adults can't resist saying them. And that's completely understandable from the adult's point of view as well. But the point is that mindfulness provides this sort of extra tool to be able to, you know, decrease the need for us to just kind of expect and want children to be able to calm down or focus just by sheer force of will. Okay, we know that children are especially bad at that. We know that we as adults are bad at that during our moments of depletion, right? So if we're tired, if we're having a relational conflict, whatever it might be, somebody telling us what to do in this way, we know that's not going to be effective. And so it's even less effective for children most of the time. So I don't believe that mindfulness is a magic bullet in any way, but I do feel that there is something potentially special about it that helps children to cope with high levels of stress and helps them be more present in the moment, both, you know, in the main settings that matter to them, school and home. So I've spent a lot of time mulling over and researching and writing about the various controversies related to mindfulness. I'm certainly aware of them. So such as, you know, worries about the separation between church and state, whether teachers need to have their own deep mindfulness practice before they can, you know, practice it with kids, whether we're implementing mindfulness with some kind of secret neoliberal agenda to get children to be quiet and do well on standardized tests. So all of these are controversies that we think a lot about, and I'm happy to answer questions about that in the Q&A part. But quickly just wanted to say, okay, how do we actually do this stuff? I thought you might want to know about what this actually looks like. So this little pie chart represents the parts of the program that that children directly experience in the K2 program. So the core program is this 3 times daily mindfulness techniques. These are scripted, and we train teachers and support teachers throughout the year in terms of their tone of voice, their pacing, and getting some mindfulness practice of their own. The other 2 that I'll just quickly point out, Calm Community is a group-based lesson that staff from Erikson go in and do kind of with the teachers, but it's one piece of the program that we take more of the lead on than the teachers. Every other aspect is we train and support the teachers to do. The Calm Spot is an app that we developed. It's not exactly mindfulness. I call it a cousin of mindfulness. And all it does is it's a non-interactive app. It plays nature videos, really gorgeous, you know, National Geographic quality nature videos. And there's like 100 videos, and they're randomly selected, and they play for 2 minutes. And then the child can go back to what they were doing. So we ask that teachers allow kids to go to the Calm Spot anytime, including during instruction. So this is based on the idea of kind of swapping it out. You know, what's better? Losing 20 minutes of content by either being disruptive or tuning out, or losing 2 to 3 minutes of content, and then maybe the next 20 minutes are much better and more relaxed. This is just to give you a sense. I'm not going to go through all of this, but this is all what I look at as the support mechanisms that allow the program to happen and with quality. And since you can't see what the program looks like until you see the video, I just thought I'd show you a couple of the different resources that we have around the classroom that you could actually see visually right now. So the posters, these graphic posters represent sort of abbreviated mindfulness techniques. So they're techniques that the children are already familiar with. So the idea is that it's kind of surrounding them in their classroom, and they can always look at a poster to kind of remember you know, some real basics of what you can do. You can just take a deep breath. You can listen to sound and silence. For the one that says feeling the breath with the boy sitting by the tree, he's in a pose that we call the calm and ready pose. And we use the calm and ready pose in lots of different contexts. It's kind of a nice, it's a calmer, it's a more, you know, humane way of kind of getting the classroom's attention. The teacher herself or himself will go in the calm and ready pose. The kids do it sometimes when they're walking through the hall. So that's another aspect of the program. And then you can see the big feelings care plan there. So this is a poster that says what to do if you're having some big feelings. So we encourage lots of these different mechanisms as a first pass instead of timeout. So rather than sending a child to a timeout to say you are not allowed to be with the group because you are acting out right now, it's a question of, are you having a big feeling right now, and would you like to do a big feelings care plan? So there's a poster version of it, and there's also a coloring page version of it that kids can do instead of a timeout. And the same with Calm Spot. We ask the teachers to use that as a first pass and hopefully avoid a timeout. So that's just to help you visualize some of the program aspects. I'm now going to turn the presentation over to my colleague, Kandace Thomas, who is in charge of the parent engagement part of our project, which I haven't spoken about yet. It's my understanding that having this kind of component is pretty unusual in mindfulness and education programs. There's another video that I can recommend called Eliza and the Mind Jar that you can Google, which shows an all-girls school in Bronx, New York, of a similar program to ours, and also has a parenting component to it, and they show some beautiful interactions there. But it's just one school, so it's unusual, I think, to be able to do parent engagement in so many different public schools at once. So Kandace will be talking about the parent engagement program as well as her dissertation research that relates to this component.
Thank you, Amanda, and thanks to the Illinois ACES Collaborative for launching your webinar series on our project, as well as your ongoing work here in Illinois. I used to be an active member of the ACEs Collaborative before I started my doctoral studies. So I haven't been involved recently, but I'm glad to join this webinar. So to start us off, since Amanda talked to us a little bit about what is mindfulness and our approach to mindfulness and toxic stress, I wanted to take a second and talk a little bit about mindful parenting, which you can assume is related to mindfulness. As you may assume, really a central tenet to mindful parenting is really that as parents, we can only give our children what we've given to ourselves first. So if you think about if you have had an opportunity to fly recently and the flight attendant says, put your mask on first before you put your mask on your child or the person sitting next to you, it's sort of similar to mindful parenting, that we can only give our children or whomever else we're caring for in life. This could extend to aging parents, ill siblings, or other family members. We can only give to someone what we give ourselves first. So elements of mindful parenting, there are a couple of central tenets of mindful parenting. And if you think about the stop sign when you're driving, S-T-O-P, this is the way I describe mindful parenting to parents in our parent engagement events. First is the S, which is stop. So wherever you are, whatever you're doing, we want you to really notice how you're feeling. Notice your stress, notice your anxiety, the pang in your stomach or the pang in your chest. Simply pause in awareness. The T, take a breath. And as with pausing with awareness, just simply breathing into your body and feeling the sensations of the breath move in and out your body. And as some of you may know, when you take a breath, it actually does, and you take a few deep breaths even, it could be really calming for you. So we want you to take a breath to give yourself a chance to self-regulate and pause before your action. The O is for observe. So in addition to noticing your awareness, taking your breath, notice how you feel. Observe what's happening in your body as you go through this experience. The P, proceed. So after you've paused, you're aware, you've observed how you are, then move on with your action. So one of the central definitions of mindfulness that I use often, either in parent events or talking to other people, is really that mindfulness really encourages us to pause so that we can be intentional about our actions, intentional about what we're going to say when we are talking to someone, whether that intentionality is out of anger or the intentionality is out of kindness. Really just taking a second and not acting in automation, not automatically turning to how you would act. So let's say your child has done something and you've told him or her 10 times not to do it. An example is my niece over Thanksgiving holiday, she really wanted to put her cat in the bathtub. No matter how many times her parents, myself, her grandparents told her, don't do it. Don't put your cat in the bathtub. And you can imagine she did it anyway. But we were annoyed and angry at her and then felt bad for her because the cat scratched her pretty badly because she put the cat in the bathtub. So noticing that even though we may have an automatic response to something someone is doing, we want to take a second and think, do I want to respond to this person in this way? So a formal definition of mindful parenting by Jon Kabat-Zinn, who you may have heard of. He is known to be someone, an American here in the U.S., who really introduced mindfulness as this type of concept to the American public. He says, mindful parenting is paying attention to your child in a particular way, intentionally, here and now, and non-judgmentally. So you could also think of mindful parenting as a meta-construct. So a way of integrating aspects of parent cognition, attitudes, and affect reactivity in parenting interactions with their children or with your children. And we have seen that, and John Kabat-Zinn defines this as that parents with high levels of mindfulness, either high levels of mindfulness practice or high levels of mindfulness characteristics, are considered to be mindful parents. So our program, CCK2, has intentionally, from the very, very beginning, incorporated parent or family engagement into our program. So what we do is we host 2 meetings at each school per year, so 2 meetings at our 16 schools twice a year, typically in the fall and the spring. And in those meetings, we introduce parents to mindfulness, and we go over the basic elements of our Calm Classroom K to 2nd grade program. We also talk a little bit about what is mindful parenting, what ways can we be mindful as parents, how can we integrate some of what students are learning in the classroom back to home. And we really talk about, like Amanda mentioned, the connection between stress and trauma. Those are the terms that I use with parents, less so toxic stress, because I feel like it gets a little bit complicated and it's hard to discuss in a forum in that way, but more so stress and trauma with parents, and how mindfulness and mindful characteristics or practices can really help buffer or mitigate or moderate these different constructs. Over last year, when we started the parent or the family engagement events at schools, over half of the parents said, we need more information, how can we learn more about this, how can we do more mindfulness at home? So we created a mindful community newsletter that we send out every 2 months to the families that are involved in our program. So these are families that have given us their email address and their phone numbers and said, yes, I want more information about this. Our newsletter contains an update on our CCK2 program. It also provides an update on exactly what may be happening in the classroom during those 8 or 12 weeks between newsletters. And then we also share resources for parents in particular or for children in which the parents can engage in. And we've had a few newsletters go out, and parents have been really happy and grateful for added resources. And then we also added what we call family liaisons at each school. So we've asked for volunteer parents, folks who are typically at the school maybe once a week, once every 2 weeks, someone who is fairly known by the parents in kindergarten through 2nd grade, that the teachers may know, or the office staff and the other administration may know. And we've asked for them to be volunteers with us, to really be a liaison between our project and the school. So their job is pretty simple. We hope it's really just, as I said, maintain relationships between the project and the school, to provide any updates if needed, to share any feedback from the school back to us, and then to also help us with organizing the family engagement events that we facilitate at each school. So they may help us recruit parents, they may help with food setup, whatever it is that we need. The family liaison has just been sort of an extra hand as a part of our project. So those are 3 ways that we engage parents in our project. As part of our meetings, we actually introduce, as I said, we introduce parents and the families to mindfulness. And overall, over the past 1.5 years, we've actually been, we think, pretty successful in our family engagement events. In general, we estimate that we get about 10% of families from each school at each of our events. So let's say there are 2 kindergarten classrooms and they may each have 20 students in them. We're likely to get 2 to 4 parents at our events from each classroom, which, from what we understand from some of the research and other interventions, that this is actually pretty successful to have parents consistently engaged in a project like ours throughout the school year. We have found so far that we have 50% return rate, which is also pretty successful. The parents who are repeat attenders to our family engagement events, and it is so lovely to see some of the parents again after a few months, and they say, I just come here because I really want 5 minutes of calm. Because we do mindfulness activities at our events, and it does offer an opportunity for people to really get grounded in being present in the moment. So while we do mindfulness activities during our events, we have found that when we introduce the term mindfulness and we ask parents, what is mindfulness? That if we just use the term mindfulness, I've estimated that about 80% of the families don't know what it means when we just ask them, what is mindfulness? But when you dig a little deeper and you ask about related constructs like yoga or even meditation, folks have heard of those phrases. But when you start to really dig deep into the definitions of mindfulness and you start to break apart some of the ways of being that mindfulness really promotes, I would say about 50% of the families that come to our events are familiar with those concepts or use similar concepts to define what we define as mindfulness. So if you ask people to be more intentional with their words or actions, parents in our events will say, well, of course, when we were kids, our mother would say, watch what you say before you say it, or think about what you're going to say before you say it, or before they touch something, like having the child pause. Do you really want to do that? So just some just general kind of awareness building from families that could be related to cultural practices, could be related to religious practices or other ways of being. But we've found that once you break down what is mindfulness, that about 50% of people are familiar with some of the definitions of it, but may not use that term specifically. So we are really, really grateful for all of the families that attend our events, and as a way to thank them, we give each family a one-day unlimited Ventra card, which is the Chicago Transportation Authority's pass to use the bus and train system. We also offer either a mindfulness children's book, and the one you have on your screen is a beautiful book called Charlotte and the Quiet Place. And we've also, because you may, if you shop at Target or Walgreens or Duane Reade, wherever you live, you'll see adult coloring books everywhere these days. And one of our staff members is just a beautiful illustrator, and she created an adult coloring book for our project. So what you see on your screen is a black and white photo of our adult coloring book that we give as a gift to the families who attend. And you see there it says, I am calm and ready. So these are some of the gifts that we give to all of the families that attend our events. We also make sure that we ask people to come to our events in the evenings or for breakfast. So we make sure we feed them. This academic year, we've had a great relationship with a local small business, a small Mexican restaurant. So we've had rice and beans and tacos for 15 nights over the past few months. But it's been really wonderful to be able to also share a meal with families as a part of our effort. And what parents tell us when we actually do mindfulness based activities in our sessions, they say, oh my goodness, this is very relaxing. Oh, I feel calm, I'm so ready for bed. I need to do this every day. Or my child really could use this at home. So we found that parents really have enjoyed the activities, and once we do it with them and we facilitate mindfulness, quiet breathing with them that they have found just in those few minutes, really 3, 4, 5 minutes. And for some meetings, I've gone as far as 15 minutes of quiet. Parents have really see the benefit of those moments. So as Amanda mentioned, I am in the very beginning phases of my dissertation study. I'm proposing at some point, hopefully soon, and I'm really interested in understanding if the conditions of mindfulness characteristics, which you may know as trait mindfulness or dispositional mindfulness. Trait mindfulness and dispositional mindfulness is how it's referred to in the research literature, if you read any research literature on mindfulness, but how really mindfulness characteristics and self-care in parents. So how do we care for ourselves as parents day to day? If high levels of both of those conditions really reduce the transmission of intergenerational trauma. So I'm interested in understanding the trauma that parents experience. I'm using something very similar to the ACEs. I'm using the Philadelphia ACEs survey that was created in Philadelphia, as some of you may know, and understanding the parent's trauma as well as the child's trauma, and trying to correlate whether or not high levels of trait mindfulness and self-care reduces intergenerational trauma transmission, but also if we see a relationship between trait mindfulness and self-care and the child's behavior. I'm also interested, though we're still trying to figure out how to answer this question, if mindfulness is a culturally relevant practice. The parents in our study, as are most of the children in our study, reflects the population of children who go to Chicago public schools, which, as you know, Chicago public schools in general, mostly African American and Latino. So the parents that I'm interested in studying are African American and Latino parents, and I'm trying to understand if they see mindfulness as a culturally relevant practice as well. So of course, I'm going to, in our spring 2017 CCK2 family engagement events, which will happen in late April, May, and June, going to be hopefully either recruiting parents for the study and or facilitating the study in those meetings. And we are very excited about what the research will tell us from my dissertation. I think we're ready. I think that may be our last slide. So,
do we have any questions, Maggie? I can't hear anyone currently.
Sorry, this is Alice from United Way. Can you hear me now?
Yes, I can.
Okay, sorry about that. Thank you both so much for the great presentation, and thank you to all of our attendees. We have a couple questions, but just to be cognizant of time, we'll only be able to take a few. So I'll start right away with this one, and it is, have you experienced challenges regarding teacher resistance and or lack of administrative support, specifically the principal?
Oh, sure. Yes. That issue kind of distributes itself, in a kind of normal curve, as you might imagine. Most, places are kind of in the middle. We have some places that are superstars and other places where it's been a much bigger challenge. All I can say is we're very grateful for the support that we have through this grant to be able to help compensate for that. So we can be in the building quite a lot. to kind of help with that and provide more support. The resistance or the lack of support from administration is not about any of those kind of other issues that I was telling you about. You know, it's not because they think it's too religious or anything like that. It's more what you might expect, just the challenges of their jobs. For those of you who are in Chicago, you know that CPS is under tremendous strain right now. So we have teacher turnover in kindergarten. We have, you know, all these kinds of things that make it really challenging to be like, hey, come and do this SEL program. But that's, you know, that's nothing more than the usual challenges of implementation that any program like this would have. And so, like I said, we're just fortunate that we have support right now, you know, enough financial support on our end to be able to just be there, you know, more than you would typically expect. But we're working right now, you know, with the schools on, you know, sustainability types of plans. And there usually is, you know, at least 1 or 2 teachers per school that seem like they're, you know, more ready and willing to kind of take it on as a champion. But like when we're in grade level meetings, for example, that's, you know, typically the way we handle it. If one teacher expresses, you know, I just really can't take this on, I don't see the point of it, you know, we would ask another teacher to share their experiences to see if they've had an easier time, or what tips and tricks, you know, have you used. It's much better when it comes, you know, from within the building, of course. It has, you know, more authenticity to it. So we handle implementation challenges the same as anyone, and there are certainly a lot this year.
Great. I had a question for Kandace. Well, first, a really quick one. People wanted to know if they could find more resources on the STOP technique. Is that something that's easily searchable on the web?
Oh, yes. That is actually something that I found on Huffington Post by an author who writes a lot about mindfulness. So you can search Mindful Parenting Huffington Post, and you should find it.
We can send you that link.
And we can also send you the link. It's from an article in 2013.
Great. We'll add that to the resources that we send out tomorrow.
Okay.
And then a question I have, this intergenerational trauma is a key element of our collaborative. And this is Maggie Litkin. I help manage the collaborative with Alex Murphy, who just asked the other question. You had talked about avoiding toxic stressed language with the parents.
Mm-hmm.
Do you talk, these schools that you're working in are high poverty areas that I think it's easy to assume have dealt with a great deal of adversity through generations. So I'm curious if you discuss historical trauma with the parents at all to give some context to this.
That is a great question. I think that over the year and a half, I may have talked about historical trauma 3 or 4 times, but I really let the audience actually steer the conversation in that way. I feel very sensitive to using research terms with lay audiences. I just feel like I just want to build relationships with the people that I'm working with before I throw out jargon that they may or may not be familiar with. Plus, some of the schools we work with are mostly Spanish speaking, and I'm navigating translation and translating words like trauma and toxic stress and intergenerational trauma transmission. I just don't think that that's a part of my wheelhouse to do all of that, while also, you know, running a discussion. But I have talked about historical trauma a few times, mostly in schools that are predominantly African American, but it's also come up from the families themselves. So they bring up issues related to slavery, Jim Crow, what's happening in their neighborhoods, and easily can connect what happens, what is going on today with what has happened in our country for the last 400 years. And then I add, so I use the term historical trauma when other folks bring that up, and it's people easily connect it and embrace the term.
Well, and just to jump in, she's talking about what she does primarily at the parent meetings, but in her dissertation, she's talking a lot about that. So she's going to have an opportunity to interview in a much more intimate one-on-one setting with 20 to 40 of these parents, and we'll be, she'll be discussing that with them. So more data to come on that when those interviews are able to happen.
Well, that's a great segue. Unfortunately, I think we could ask you questions for a long time, but this is the end of this webinar, and so we'll be very much looking forward to the research that comes out of this specific project, as well as your research, Kandace, into what you're searching and highlighting in certain areas. So thank you very much for both of your time. I certainly learned a lot, and this was a great asset to adding to the knowledge base. And we have people from across the country on this call, and so we thank you for being leaders in this movement to reduce toxic stress. There's this final slide is about more information with our different contact information, and you can follow the Illinois ACEs Response Collaborative for similar webinars and to discuss if you would like to be involved. And like we said, we'll be sending you a follow-up email with more resources as well. So thank you very much for your time, and thank you again to the presenters. Have a great day, everyone.